Ever notice a dog suddenly doing something? Oh, odd. A strange little kick, maybe, or a momentary stiffness that just seems to appear out of the blue can be a bit unsettling, actually.
Yeah, it really can.
So today, we're diving deep into what might be behind these curious behaviors, canine movement disorders. It's a really fascinating and sometimes pretty puzzling area.
That's right. We're going to explore this whole world of non-epileptic involuntary movements in dogs. We've got a really comprehensive overview of canine movement disorders here.
Okay.
And our goal today is really to unpack what these conditions are, who tends to get them, and try to understand what might be going on when our dogs show these, well, unusual movements.
Okay, let's get into it then. Our mission for this deep dive is basically to get a handle on the main types of these disorders, look at their potential triggers, and maybe most importantly, understand what makes them different from other things we might see, like, say, seizures.
Yeah.
We really want to give you a clearer picture of these sometimes quite strange occurrences. So when we talk about canine movement disorders, what's the core concept?
Well, fundamentally, we're talking about disorders that start in the central nervous system, the CNS,
Right.
and they cause involuntary movements. Now, these can be continuous, like a constant tremor, or they might just be episodes of abnormal movement.
Episodes, okay.
Yeah, you might see things like dystonia, that's where muscles contract and cause twisting or repetitive movements, or more jerky things like ballism, chorea, or athetosis. But the key thing, and this is really important,
Mm-hmm.
is that the dog is fully conscious during these episodes. It's not epilepsy.
Okay, so totally different from a seizure. That's a crucial distinction right there.
Yeah.
And these movements, they can be quite localized, can't they? Like just one limb,
Yeah.
or can it be bigger?
Exactly, yeah. It could affect just a single limb, maybe just one paw, twitching, yeah.
Yeah.
Or it could involve multiple limbs, sometimes even the whole body. And the overview also introduces this idea of hyperkinetic movement disorders, which often show up as what we call paroxysmal dyskinesias.
Okay, paroxysmal dyskinesias. Break that down for us.
Sure. So paroxysmal just means it's sudden, it comes in episodes, and dyskinesia refers to abnormal movement.
Got it.
So basically, you're looking at these certain bursts of abnormal movement or maybe increased muscle tone, which then go away, and the dog seems completely normal in between.
Right, alternating with normality. That paints a much clearer picture. And what's actually going on underneath, neurologically, I mean? What causes these?
Generally, the root problems involve issues with how the central nervous system communicates. So it might be abnormal neurotransmission.
Mm-hmm.
The signals between nerve cells aren't quite right.
Okay.
We also see things called ion channelopathies. Think of nerve cells like circuits. And these ion channels are like tiny gates controlling the flow of ions to the electrical part.
Right.
If those gates malfunction, it messes up the signals. And then there's neurotransmitter dysfunction, basically. The chemical messengers in the brain are out of balance.
Okay, so signaling problems, gate problems, or chemical imbalances. Makes sense.
Mm.
So who usually gets these? Are certain dogs more prone? Age? Breed?
Yeah, the overview definitely points out that these are seen mostly in dogs, actually less common in cats.
Interesting.
And there are absolutely breed-related syndromes, which we can get into. And often the onset is before the dog is 3 years old. But that's not a hard rule. It can vary.
Breed-related often suggests genetics, doesn't it? So if a vet suspects a movement disorder, what are they looking for in an exam? Especially if the dog seems fine between episodes.
Well, that's the tricky part. Often the initial physical exam is completely unremarkable. The dog seems totally normal, which makes diagnosis pretty challenging. That's why getting a really detailed history from the owner is absolutely vital. Descriptions of the episodes, even better. Videos. That's gold.
Videos, right, because the signs aren't always there in the clinic.
Exactly. The lack of signs between episodes maybe suggests it's more about those transient signaling issues,
Yeah.
rather than a constant structural problem in the brain or spine.
Right, that makes sense. So let's dive into some specific examples. The overview mentions paroxysmal dyskinesias in certain breeds. What do those episodes actually look like?
Okay, so in breeds like Bichon Frieses, Belancas, Border Terriers, sometimes they call it canine epileptoid cramping.
Epileptoid cramping.
Yeah. And also Chinooks, soft-coated Wheaten Terriers. In these guys, you might see things like repeated flexing or kicking, usually a hind limb.
Just kicking.
Yeah, or maybe difficulty walking, sometimes extensive rigidity that's like a stiffening out. This can lead to ataxia, poor coordination, or even an abnormal curve in the spine like kyphosis or scoliosis. Some dogs might even get this walk backward.
Walk backward. Seriously, that's very specific. Are there other signs that go along with this, like drooling or anything you see with seizures?
Generally, no. You don't usually see those autonomic signs, the drooling, the urination,
Hmm.
and the dog's mental state usually seems normal throughout the whole thing.
Okay.
Although it's worth noting, some border terriers might actually vomit or have diarrhea during an episode.
Oh, interesting.
And these episodes, they can last anywhere from just a few minutes up to several hours. And a common trigger seems to be excitement or stress.
Ah, excitement and stress. That sounds like a recurring theme. Now, what about episodic falling? The overview mentioned that in Cavalier King Charles Spaniels and Scottish Terriers.
Right, episodic falling. In CKCS and Scotties, where it's also known as Scotty cramp, it's more about this pronounced muscle hypertonicity.
Hypertonicity, so really tense muscles.
Exactly. A real tightness. They can't seem to relax the muscles in their body and limbs. This causes stiffness, maybe that arched back, the kyphosis again, and sometimes they actually collapse, either sort of sideways or falling forward. And again, just like the other dyskinesias, these episodes are often triggered by excitement or stress. It's quite interesting, isn't it? Similar triggers.
Yeah.
But the way it manifests physically can be quite different depending on the breed. Maybe points to different vulnerabilities in their neurology.
It really is fascinating. Now, the Jack Russell Terrier example sounded quite serious neuromyotonic collapse, and something about hyperthermia?
Yes, that one is quite concerning. It's seen in JRTs, often linked with hereditary ataxia, muscle twitches called myokymia, sometimes even facial rubbing.
Okay.
During an episode, the dog often ends up lying on its side, lateral recumbency, and they're very rigid. They seem conscious. But the big worry is severe hyperthermia, a really dangerous spike in body temperature.
Oh, wow.
These can last for hours and seem to be triggered specifically by hot weather. We've also seen something similar in dachshunds.
Hot weather trigger. That's critical for JRT owners to know.
Absolutely. That specific heat trigger suggests maybe a particular sensitivity in how their body regulates temperature when this underlying neurological issue flares up.
Okay. Then there's startle disease in Irish Wolfhound puppies. That sounds dramatic, too.
It does. With startle disease, you see this extensor rigidity, that sudden stiffening, but specifically when the puppy is handled.
Only when handled.
Yeah, apparently they seem totally relaxed when sleeping. The overview also mentions cyanosis, that bluish tinge, suggesting maybe a temporary issue getting enough oxygen. And it's suspected in lab puppies, too, ones that show reflex myoclonus, those sudden muscle jerks in response to a stimulus.
Huh. And finally, head tremors or head bobbing. I think I've seen videos of dogs doing that. What's the deal there?
Yeah, you see that in Dobermans, English bulldogs, boxers, some others too. It looks like rapid yes or no movements of the head,
Right.
often triggered by stress, but the good news usually is that it's interruptible. If you distract the dog, it often stops.
Oh, okay.
But how long it lasts or how often it happens can be really variable, quite unpredictable.
So we've definitely covered a wide range of how these things can look, and it really sounds like genetics must play a big role with all these breed links. The overview mentions specific genetic defects.
Absolutely. For Cavaliers, they've linked it to a defect in the brevican gene. In Irish Wolfhounds, it's related to the glycine receptor.
Okay.
For Russell Terriers, there's a gene called KCNJ10 involved, and for soft-coated Wheaten Terriers, there's also a known genetic link. It really highlights how important genetic research is here.
Yeah, definitely.
It's kind of amazing how one gene fault can cause such specific neurological signs.
It really is. Now, apart from these known genetic links, are there other things that can cause or trigger these movement disorders?
Yes, the overview points to a few other possibilities. Things like metabolic problems. Certain drugs can also trigger them, like phenobarbital can sometimes cause dyskinesia, or there can be reactions to propofol anesthesia. And we can't forget toxins. Certain herbicides, mycotoxins, those are toxins, from molds, chlorinated hydrocarbons, even bromethylene, which is found in some rodent poisons, they've all been linked.
Wow, quite a list. Genetics, metabolic issues, drugs, toxins. And we already talked about common triggers like excitement, stress, exercise, and that specific heat trigger for JRTs.
Mm-hmm.
Now, maybe the most crucial part, telling these apart from other problems, especially epilepsy. What are the key differences a vet looks for?
That is absolutely critical in the diagnosis. With epilepsy, you usually see an altered mental state during the seizure, unless it's a very focal one. The dog might seem unaware, confused, or even lose consciousness.
Okay.
Seizures also tend to be pretty short, usually less than 5 minutes. And very often you get those autonomic signs we talked about, urinating, drooling, dilated pupils.
Right, the drooling, etc.
Yeah. You generally don't see those with these primary movement disorders where the dog stays conscious and aware.
Okay, altered mental state, short duration, autonomic signs, those point more towards epilepsy.
Got it. What about things like obsessive-compulsive behaviors? Dogs get into repetitive habits sometimes.
That's a good question. With OCD-type behaviors, you might see repetition, sure, but the dog's mental state is normal, and their muscle tone is normal too. And importantly, you can usually interrupt the behavior.
Ah, interruptible.
Exactly. You can distract them. That's generally not possible with the involuntary muscle stuff happening during a movement disorder episode.
And how do vets rule out pain? Could some odd movements just be pain-related?
Definitely something to consider. The overview specifically mentions looking for spinal pain. If the movements seem linked to discomfort, or there are other signs pointing to back or neck issues, that suggests it's more likely a musculoskeletal problem, not a primary CNS movement disorder.
Makes sense. The overview also lists myoclonic epilepsy and myotonic myopathy as things to rule out. What's the difference there? Okay, so myoclonic epilepsy involves these repetitive sort of shock-like muscle contractions, often set off by a specific stimulus. Seen in breeds like mini wire-haired dachshunds, beagles, basset hounds.
Okay, stimulus-induced jerks.
Right. Myotonic myopathy is different. That's more about muscle stiffness or even collapse that gets worse after rest. A classic sign is myotonic dimpling. You press the muscle, and the dent stays there for a bit. Seen in chow chows, mini schnauzers.
Dimpling, huh?
Yeah. These have different underlying causes than the paroxysmal dyskinesias.
And quickly, it also mentioned Cushing's disease and a cat-specific issue.
Yeah. Hypergenocorticism, or Cushing's, can sometimes cause odd muscle activity. And while we're focused on dogs, cats can get something called potassium-aggravated muscle stiffness, which is, again, a different metabolic issue.
Okay. And finally, exercise-induced collapse in labs and constant repetitive myoclonus.
Right. Exercise-induced collapse, or EIC, is specifically triggered by hard exercise, common in labs and some other breeds. Constant repetitive myoclonus is different. Again, those are muscle twitches that just keep going, even when the dog is resting or asleep.
Even asleep.
Yeah, that often happens after something like encephalomyelitis, brain inflammation, or exposure to certain toxins. The fact it persists during sleep is a key difference from most episodic movement disorders.
Wow, okay. So it really sounds like veterinarians have a complex puzzle on their hands when a dog comes in with these kinds of movements. What does the diagnostic process typically look like? We know basic blood work is often normal.
That's right. Routine blood tests, urinalysis, they usually come back normal in these primary movement disorders. But other lab tests can definitely help. Genetic testing is available for some specific breeds now, which is great for a definitive diagnosis.
That's helpful.
Then they might check electrolytes, CK levels, that's creatine kinase, for muscle health, liver function, glucose, thyroid hormones, maybe an ACTH test to rule out Cushing's or Addison's. Sometimes they might do more specialized neurometabolic screening, looking at things like lactate, pyruvate, specific acids in the urine or blood that relate to brain energy and function.
And what about imaging, like MRI?
Yes, MRI of the brain and spinal cord is often really important, mainly to rule out other causes like structural problems, tumors, inflammation, things that could cause the movements but aren't a primary movement disorder themselves.
Gotcha. Ruling things out, are there other specific diagnostic procedures?
Definitely. As we mentioned, video from the owner is incredibly helpful.
Right, the videos.
For Scotty cramp, there's actually a provocative test using a drug called methizerguide. It can sometimes trigger an episode in the clinic, which helps confirm it.
Interesting.
Video EEG, that's electroencephalography, while recording video, is the gold standard to definitively rule out epilepsy by checking brainwave activity during an event. EMG, electromyography, looks at muscle electrical activity. And a CSF tap, analyzing cerebrospinal fluid, helps rule out inflammation or infection in the CNS.
It sounds like a really thorough workup is often needed. And what about under the microscope? Any typical findings in the tissues?
Well, interestingly, the overview says that in most cases, the pathology, what they see in the tissues is often unremarkable. Not much to see.
Really?
Yeah. The one exception mentioned is stiff Labradors, where they sometimes find something called astrogliosis, which is basically an increase in certain types of support cells in the brain.
So diagnosis is tough, and it sounds like treatment might be too. The overview mentioned a lack of evidence-based treatments often. Why is that? Why are they hard to treat?
Yeah, that's a major challenge. It's likely because, well, it's such a diverse group of conditions, right? Different underlying causes, many of which we're still figuring out.
Hmm.
Plus, the lack of specific biomarkers, tests to track progress, and the fact that many are episodic makes it really hard to design studies and prove if a treatment is actually working effectively. Research is happening, but it's can be slow going.
That makes sense. So management often circles back to avoiding those triggers we talked about.
Exactly. Environmental control is key.
But are there any medications that are sometimes tried, even if the evidence isn't rock solid for every condition?
Yes, there are some. For those stiff Labradors, they do seem to respond positively to NSAIDs, nonsteroidal anti-inflammatories.
Okay.
Other drugs sometimes used include diazepam or clonazepam. Those are benzodiazepines. They can help with muscle relaxation sometimes. Acetazolamide is another one, though you have to watch for side effects like tummy upset, lethargy, weakness.
Right.
There's also 4-aminopyridine and even fluoxetine, an SSRI antidepressant, has been tried in some situations. It often ends up being a careful process of trial and error, really,
Yeah.
seeing what provides any relief for that individual dog.
Trial and error. Okay. And what about anti-epileptic drugs? Since these aren't seizures, do they help at all?
That's a really important point the overview makes. Typically, these primary movement disorders do not respond to standard anti-epileptic drugs.
Okay, good to know.
It's another key way they differ from epilepsy. The underlying brain chemistry or circuitry issue is different, so seizure meds usually aren't effective.
Right. So if a dog does get diagnosed, what are the long-term things owners need to think about? Management, monitoring.
Yeah, careful monitoring is definitely key, especially if they're on meds like acetazolamide. Watching for side effects like low potassium or acidosis is important. But mostly, the focus really has to be on identifying and avoiding those known triggers whenever possible.
Avoidance is key.
Absolutely. And for those Jack Russells with the neuromyotonia, preventing overheating is absolutely critical because hyperthermia can be a fatal complication.
Life-threatening, right?
Yeah. And beyond that, unfortunately, the course and prognosis, like how often episodes will happen, can be really unpredictable.
Mm.
It varies a lot between individual dogs.
Okay, so let's try and wrap this up. Our deep dive today shows that canine movement disorders are, well, a really diverse and sometimes pretty baffling group of conditions. They show up in so many different ways, triggered by different things, and telling them apart from epilepsy or other issues is just so crucial. It really sounds like sharp observation by owners and working closely with a knowledgeable vet are absolutely key for getting a diagnosis and figuring out a management plan.
That's exactly right. Recognizing those potential triggers, maybe getting video of the episodes, the kind of information is just invaluable for the veterinary team.
It really is. Considering just how intricate the brain's wiring is and how these subtle glitches can cause such varied, sometimes dramatic signs, it makes you wonder what other factors, maybe things we think are unrelated, might actually be playing a role in these fascinating quirks of canine movement.
That's a great question.
It really highlights the incredible complexity of the nervous system, doesn't it? And how much we're still learning. If you want to explore this more, we definitely encourage you to look into health information specific to your dog's breed and keep an eye on the latest research in veterinary neurology. Thanks for joining us for this deep dive.